Imagine this, you're a brand new parent, just getting used to having this perfect little being in your life, when you notice a prominent bright red patch on your baby's skin. Now, doctors tell you it'll go away with time, but you want a little bit more information, more answers, more peace of mind. Well, here to tell us more about this infant skin condition and a groundbreaking novel treatment is Director of Dermatology and founder of the Children's Skin Center at Miami Children's Hospital, Dr. Ana Duarte. Good morning.
Good morning.
Thank you so much for being here.
It's a pleasure to be here. Thank you.
I've heard about this condition. I actually studied it while I was in school. It's commonly called like this strawberry mark, right?
Yes.
Tell me more about this.
It's called an infantile hemangioma, and it's a very common tumor of infancy. It's caused by an overgrowth of blood vessels on or just underneath the skin, and it's commonly present on the face, on the neck, and on the scalp of babies. However, it can occur anywhere on the body. It happens over the first few weeks. The mother may notice a very subtle little patch, a pink patch, or even sometimes a little white spot. It's called a precursor lesion, and that's all they'll see, and then suddenly it starts to grow.
All right, so I have a few questions. How common or rare are these tumors?
Very common. It's the most common vascular tumor of infancy. 1 out of every 10 infants will be born with a hemangioma of infancy.
Now, you mentioned the word benign, so can they get dangerous?
Hemangiomas, if they involve a vital structure such as the eye, the nose, the mouth, can interfere with vision permanently, causing visual impairment. Breathing, feeding, which are all key to a baby's survival. They can also ulcerate, be very painful, cause permanent scarring and disfigurement.
A couple more questions. Specific demographic?
More common in girls and more common in Caucasians. Premature babies, twins, babies of low birth weight, babies whose mom have undergone fertility treatments, and babies whose moms are getting a little older in age.
Is it hereditary?
It's not thought to be hereditary.
Now again, I understand until recently a lot of doctors would say, oh, let's watch, let's wait, and let's see. That's not the best approach, is it?
It's the approach that we're moving away from because of all the sequelae, all the problems that can occur in that watch and wait period. Yes, they're benign and they'll go away over 9 years, but in that period of time, 1/3 of these lesions on the face can result in permanent soft tissue damage, and also 70% over the body, permanent scarring. I have seen patients with severe scarring on the face, and then you have to undergo a lot of reconstruction. So the most important message is early intervention, prevent the ulcerations, prevent the scarring, prevent that permanent soft tissue change. So if your baby has a lesion you suspect may be a hemangioma of infancy, definitely call your doctor.
And before this, there was really no FDA-approved treatments out there for this condition, but today there is, and I want to talk more about that because there's a lot of hope out there for people who have this condition. And when we come back, we're also going to hear and meet this adorable, adorable special guest whose life has been changed because of this new FDA-approved treatment. She's gorgeous. She's 7 months old. You've got to stay tuned and meet this gorgeous little girl. We'll be right back. Welcome back to The Balancing Act. We're rejoined by Dr. Ana Duarte from Miami Children's Hospital. And what a treat, as promised, we have with us a very special little guest who was taking a nap, and I think she's waking up. Alanis Urbizo is here with her dad, Ahmed, and her mom, Ana. Good morning. Thank you so much for being here.
Good morning.
Oh my gosh, she's so pretty. Hi, Mama. Remember me? Yes, you do. Look at this smile. I even get a smile in the morning. I love it.
Wake up smiling.
Ahmed, let me ask you a question. Tell me when you first noticed the hemangioma on her arm, which I can see there.
Yes, it was, I think it was the second day.
The second day she was born?
She was born. It was, I mean, it was almost invisible. It was just a little, you know, darker than normal.
Something?
Yeah.
But I also know, and I was talking to your wife, she was explaining to me that it was a little bit hard to put clothes over her arm, that it would be a little bit uncomfortable for her. Can you tell me about that?
Yeah, it was because I think the skin, that part was sensible. And
it bothered her.
Exactly, it bothered her. And then we preferred, you know, like cutting the slips out.
Now, I know, Ahmed and Ana, you took her immediately to Dr. Duarte. Doctor, when you saw her, did you immediately give him a diagnosis of what it was?
I did. It was a hemangioma of infancy, which is what we're talking about, and it was quite large. And so I had her evaluated right away to start her on the hemangio. the propranolol hydrochloride.
And that's what I want to talk about now, if we may, because it's an FDA-approved treatment and it's making such a difference. Let's talk about it. What's the name again, and how was it discovered?
It's called Hemangiol, which is propranolol hydrochloride.
Okay.
And it was actually discovered in France. It's a great story. A physician treating a patient who had a cardiac condition and a large hemangioma on her face started the patient on a beta blocker, propranolol, for the cardiac issue, and she started to notice the hemangioma started to melt away. And so she made that observation, and she approached Pierre Fabre, the company which has developed Hemangiol, the propranolol hydrochloride.
How fabulous.
And they did the clinical trials, found to be safe and effective in the treatment of this condition. And make a long story short, it was FDA approved last year in March.
Wow, and how is this one different, let's say, from other treatments, doctor?
Well, this was designed specially for babies. It's alcohol-free, paraben-free, and sugar-free, and it's not a steroid. So it's win-win. It's a real game changer in the treatment of hemangiomas.
Ahmed, when the doctor put your daughter on this FDA-approved treatment, did you notice a difference immediately?
It was a huge improvement. I mean, it was day after day, you noticed, I mean, especially the exterior parts, they started to, you know, like lighter. And the skin was changing the color. It was going back to normal.
The clinical trial showed that 6 out of 10 patients by 6 months of treatment will have total or near total resolution.
Wow, that's amazing. Doctor, for families out there that maybe are getting this diagnosis today, is there a support group out there that they can reach out to?
Absolutely. There's a couple organizations which are excellent. The Vascular Birthmark Foundation, as well as NOVA, which is the National Organization for Vascular Anomalies.
Doctor, the website for the product?
Hemangiol.com.
Thank you so much.
You're
Thank you
welcome.
so much for sharing your story. God bless both of you.
Thank you guys
and
for having
you. Dopey, 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 right? Dopey, dopey. See? God bless her. Thank you so much. I used to do dopey, dopey with my girls. You'll find all this information about infantile hemangioma on our website, thebalancingact.com, thebalancingact.com. Don't forget also we're on Facebook and Twitter.
Hemangiol should not be given to children with certain conditions. Talk to your doctor if Hemangiol is right for your child. Hemangiol can cause serious side effects, including low blood sugar, especially if your child is not feeding or vomiting. Know the signs and symptoms of low blood sugar. Other serious side effects can include new or worsening slow heart rate or low blood pressure, breathing problems, or wheezing. Hemangiol may increase the risk of stroke in certain children who have severe problems with the blood vessels in their brain. The most common side effects include sleep problems, worsening respiratory tract infections, diarrhea, and vomiting. These are not all the possible side effects of Hemangiol. For more information about Hemangiol, please talk to your doctor or visit hemangiol.com.